Spent a lot of time on this one.
All right.
A lot of time. Too much time. I'm trying to learn this
appreciate
stuff
you.
as well as I can. But what I wanted to kind of touch on is that I actually have a meeting with some people tomorrow about expanding the other side and started utilizing more like cryotherapy, red light therapy, and all these new techniques that we have to not treat disease. That's what I try to get you to understand. I'm really about upregulating your function back to actually normal for a lot of you. A lot of us are functioning at 50% of our capacity, and the thing is, there's so many things that we can do to upregulate not only your mitochondria and energy, and then also at the same time prevent a lot of disease. To me, it makes more sense to prevent disease than try to treat it later. So that's what I want you to go home with tonight. I'm not using this to treat anything. I'm just using hyperbaric. Let me explain to you. We'll get into this. We're going to read this. Then the Lord God formed man from the dust of the ground and breathed the breath of life into his nostrils, and then man became a living being. So oxygen, it's all about oxygen. But I'm going to dedicate this to my mom tonight because as she started getting older, she was having some pretty significant cognitive issues. And it really scared me because that's one thing I do not want to get. And I had a rough time through the 70s and 80s, as some of you probably might remember, with, having fun, partying, okay? So I'm sure I've done some damage there. And so I bought the Hyperbaric for me. I bought the Beamer for me, like we're going to talk about a little bit tonight. And I get adjusted on a regular basis, and I do all kinds of nutritional stuff, especially limit the amount of sugar. But my mom, her issue was that she liked sugar, and she was in denial about it, and sugar to me is a drug. And she goes, well, I don't eat that much sugar. And I go, Mom, you just had a granola bar and a friggin' Gatorade. There's like 75 grams of sugar right there, So sometimes people don't understand that maybe it's not table sugar you're eating, but it's in everything. That's why I don't like you guys eating processed food, because not only has sugar. Like somebody gave me some stevia the other day. That stuff's nasty stuff. Stevia, the artificial flavorings, and all the seed oils like we talked about at the Carnivore Workshop. And then, we're finding out about all the phytotoxins that are in a lot of the vegetables. So again, there's a lot of things we can do to minimize that exposure. And I'm still working with that and trying to figure that out, but it's all, still experimental for me. And it's working good for me. I think I'm sleeping better, and I'm also having better clarity of thought. I don't know if tonight's going to be that experience. I got home from snowboarding on Sunday, and I was wiped, okay? Just so exhausted, and I slept so good. And when I have a good night's sleep the next night, plus I drink coffee, which that always screws me up too. All right, so you can go 46 days without food. I thought it was only 40, but I guess it's 46. I thought this was 7 days without water. You can go 4 minutes without oxygen. There's people that I can go 4 minutes without oxygen in the hyperbaric. But then you can only live a millisecond without what? Nerve flow. So again, we're going to talk about all the hyperbaric stuff, but I want you to understand there's all these different spokes in the wheel that contribute to your longevity and regulating your function. Just like you and I are both doing the detox program, and I've noticed a little bit more energy from that, and you've noticed some great benefits. I mean, I don't know if you want to share any of that, but if you've lost a lot of weight, that's one thing. How many would you have lost?
From what baseline?
From the beginning when you started?
Like 40 pounds.
It's already 40 pounds. I mean, the thing is, it's just, again, it's not, this is a weight loss thing. It upregulates function, so your body, your thyroid, everything works better. You got more energy to do more things. And then, you're learning from, like, both him and I. Are you still doing the carnivore pretty much?
Yeah. More or less, yeah.
Yeah, I mean, it's a super easy way to eat. And it's a modified carnivore, but again, you got to take into consideration all these other factors. I don't want you to think that this is just the holy grail. It all synergistically works together. Everybody gets that? Right?
Yes.
So it's not only the detox, it's like today, I went to the beach and there were no waves, so what did I do? I put my shorts on and I ran in the sand and lifted some weights and did some pull-ups, and did some push-ups, did some crunches, did some jump squats, and I'm good to go. I'm grounding at the same time. So there's all these things that you can do to maximize your function. And then be happy and grateful, right? The importance of oxygen. Oxygen is the fuel required for proper operation of the body systems. Without it, we survive for just a few moments. About 75% of the oxygen we breathe is used for brain function. Okay? Your brain is 83% water. The remaining 25% goes to the first the vital organs and then the extremities of the body. your brain is a lot of what? Cholesterol. That's why I don't like the statins, you guys. I mean, you guys know how I feel about statins. Oxygen feeds the body, supports the immune system, okay? Helps destroy toxic substances and promotes new cell growth. Anaerobic bacteria, which mean bacteria that don't like what? Oxygen, gets killed off by it. Fungi, viruses, cancer all have one thing in common. They don't like oxygen. So, we got a couple testimonies that we're going to throw in here a little bit later. And cancer loves what?
Sugar.
Especially high fructose corn syrup, okay? And it also loves an acidic environment. That's why we promote the alkaline water, okay? All right. And then I bought the Beamer for me. In fact, do you have those papers? Where are those papers at?
They're right there on the corner of the table.
Okay. Was it just one page?
Mm-hmm.
Okay, cool.
Page.
So just pass these around, share them if you will. Pass these up for me. This is basically a paper on the number one disease is going to be what? I've already told you guys. See how many people are listening. It's not going to be cancer. It's not going to be Alzheimer's.
Thank you.
And there's a lot of reasons that is. You guys all carry those bioweapons around and you're close up to your head, right? There's one reason. All the toxicity from the spray, from the drinking water. In fact, how many people saw the Del Bigtree show? I think it was last week. Was it last week or the week before? They talked about all the stuff that I've always talked about. In fact, I talked to Del about it 5 years ago about chemtrails, and he thought I was nuts, and now he's actually on board. So it's a slow, gradual process, waking the world up to things that, I mean, I've always... And then my mom, like I told you guys, I wanted to be a dentist, and I didn't want to be a dentist. My mom wanted me to be a dentist, and then I decided to go to chiropractic school, and I converted all my brothers into chiropractors, and they didn't go to, so my mom was pissed. But she was like on this fluoride thing. She like thought I was nuts about saying you got to get the fluoride out of the water. And then Del Bigtree had somebody on the show talking about, you know. And again, I know I beat this dead horse a lot, but like if you think you're eating healthy and you're still showering in toxic glyphosate water, like you think you're eating organic food, but then you're showering and there's glyphosate in your water. Not to mention fluoride and the chloramines, and that all gets absorbed in your skin just as readily as if you were eating it. So you got to get, and if you can't afford a whole house system, at least get the shower filters. They're like we're on special right now for $219 or something. So, and did you get one? Is it easy to install?
Oh, yes,
It's so easy I could do it, and I'm not a handyman. All right, so and then I bought this, and every morning when I get up, I do the Beamer on my brain to open up the microcirculation. I do it on 2 because I don't want to fry it. I already did that in the 70s, as I already mentioned, and the 80s too, probably. But then I also do full body to open up all the microcirculation, because if you're not getting oxygen cells, those cells are what? They're dying. Okay, that's what the senescent cells are. They're just ready to die. And what the hyperbaric can do, it can actually revive a lot of those cells. But we're going to get into all that in a minute. And the other thing I want to talk about is, and I'm going fast because I got a special guest coming on at around 6, is that the whole thing with what we're doing in the office is we're decreasing your sympathetic dominance, but I also feel that the hyperbaric helps do that as well. And part of being in a sympathetic dominant state, which most of us are in, you all breathe really what? Shallow. So I'm really trying to get you guys to breathe more from your belly. So that's why every night before I go to bed, I do the Wim Hof exercise. Anybody else do that? I think it's a great way to help oxygenate your blood, because we all breathe too shallow. That's why when I worked out today, I did some sprints in the sand to get my heart rate up and my oxygen. So you got to do that stuff on a regular basis if you want to stay healthy. Capiche? Okay, cool. There's a hyperbaric chamber that we have. How many people you've all seen in the chamber we got over there, right? I should put that thing in the front office. I think it would get utilized more if I had it in the front office. You guys would have to trip over it on the way in. Hyper means what? Increased. Baric means pressure, right? So we're increasing the pressure of the oxygen that goes into your lungs. And how many people have snorkeled before or been like scuba diving? So 1 atmosphere is going to be at sea level, right? So like I went to the mountains this weekend. I went snowboarding at 11,000 feet, right? And what I noticed is that my heart rate was much higher than it is typically. My heart rate usually runs around 60. And it was probably at about 90 up there. And it's because the air is thin and your body's got to pump more blood through that system to accommodate for the decrease in the atmospheres, because at 18,000 feet, the pressure is half. So at 11,000 feet, it's probably like something like 0.7, okay? So in retrospect, if you go underwater 33 feet, which is a pretty good depth for somebody that's, like I was just telling somebody a story about the sharks. Was that you? Yeah. I was in the Marshall Islands, and there was where we were at was like a shark reserve, and I would go snorkeling, and there were all these sharks, man. But it was actually pretty cool because they were reefies. They're not going to bite you, at least supposedly. They're not going to bite you. That's what they tell you. Sure, if they're hungry enough, they would, or they were mistaken. They thought you were something else. But that's why I really got into snorkeling there. But I really had to learn how to clear out because of the pressure. And if you go down 33, so the pressure that we use here is 1.3 atmospheres, which is equivalent of going down about 11 feet into the water, which is not huge. But water's what? Really heavy. If you ever got drilled by a wave, you know what I'm talking about. So that pressure of the water is the same that you're going to be getting in that chamber. So that's why you got to learn how to clear out your ears while you're in there, so that you can avoid that pressure there. All right. I'm gonna skip this slide because basically let's just go over the gist of it. You're increasing the flow of oxygen through the capillaries. Again, that's why the beamer is good, because it opens up that microcirculation, but it also increases the flow of oxygen into the interstitial and intracellular fluids. So you're basically not only increasing the pressure within the blood, but it's pushing it out into those tissues. Everybody with me? And that tissue is where all the cells are, and you're getting things like your mitochondria being enriched, your endoplasmic reticulums being enriched, and that's really the powerhouse. That's where you get the ATP that's generated to give you energy, right? So as we lose mitochondrial function with a lot of people, and we have decreased oxygen, and I've heard this before, and I just heard it on the show, that the air that we breathe now is what? It's 21% oxygen. But pre-industrial revolution, before we started cutting all the trees down and spewing all kinds of fossil fuels in the air, it used to be as high as 36%. And if you look at some cities that we live in, the level of O2 in the air is going to be like as low as 11% from all the toxicity. So I'm trying to get you to understand why we maybe have part of a cancer crisis and some of the other things that we're going to touch on, because everything comes down to energy and vibration, and your health is not just merely of absolute symptoms like we measure here. We try to check to see where you're at energetically, and there's a lot of factors to that, but I think a huge factor that most people miss out on is the lack of oxygen. So HBOT, hyperbaric oxygen, heals wounds. That's the bottom line. That's why I advertised to the 3 boob shops that we got here. There's 3 of them in this complex, okay? And those people will pay for it because they don't want to look trash for it. It speeds up the healing time. Hyperbaric will speed up healing 70% versus 90%. It reverses hypoxia, which is a fancy word for having a lack of oxygen into those cells, okay? So people that have like diabetes, that have decreased circulation at their feet, they get those gangrenous ulcers on their... So the thing is, we've even seen that with the beamer. We can treat them with the beamer, open up the microcirculation to feed those areas, because basically those cells are dying. That's what gangrene is, okay? This is what I want you to go home with. Almost every disease known to man is because you've got too much inflammation. The hyperbaric notably decreases inflammation, fights infection. So I think it should have been utilized for things like, supposedly, if there is really a COVID, and I'm reading all these books right now, and I'm kind of like, I'm reading that Predators book up front, and then I just finished Alex Jones' book on the Great Reset, and you see how it all fits together, okay? So again, one of the things, if we want you, like if you had staph infection or something, I think like people that have recurrent like lung issues, whatever the infection is, you'd benefit by getting in that tank. Another amazing thing that you'll have an exponential rise in stem cells, and this is not like most people think about stem cells from exogenous sources like that you sourced out from umbilical cord or whatever. But what the hyperbaric does is it stimulates your own body to make stem cells, and especially where you need them. So if you're focusing, like for me, my focus is on what? My brain and prevention of things like cancer and all that stuff. And that's what that's the way I want you to look at it. And then, so this basically does all that for any wound. But the thing is, as we age, right, it's an accumulation of micro traumas and macro traumas that we experience through life that slowly cause our body to degenerate. And like you saw with that video that I played before, is if we can increase the telomere length, it's going to increase the longevity of the body. We got some fruit over here from Robert. All right. Also, we can use it for increased performance, increased energy levels, shorten repair time, obviously improved oxygen, like I talked to you today. It helps improve detoxification and decreases lactic acid. We already talked about the mitochondria and ATP, and we'll talk about oxygen saturation in a minute. FDA approved for HBOT is delayed radiation injury. Like if you're having cancer done and you're getting like burns from that, this helps with that. Diabetic foot ulcers, osteomyelitis, sensory neural hearing loss, crush injuries. I had a lady that just came to me the other day that said she was getting poison in her house from carbon monoxide. She didn't know that. Could be a great way to help with that. Gas gangrene, necrotizing, severe anemia, thermal burns. And one of the guys I was just studying, he was talking about, he worked in this trauma center, and all the burn patients would come in and they would see just dramatic results from just treating people with burns. This is a whole list of everything else. Okay, I'm not going to read them all. I was kind of like blown away about Lyme's disease, though, how it helps with that, because that seems like something that's so hard to treat. And again, it's not just going to be doing the oxygen therapy for Lyme's. There's a lot of things that we can do for that. Here's the big one right up here, I think, for most people, for me at least. I don't want to get Alzheimer's. And then we work with a lot of kids. I've got a great testimony from a mom with autism and everything from, like I talked to somebody else about multiple sclerosis today. When your posture is really bad, your cord gets stretched. And when you stretch the cord, it causes the vascular supply in that cord to be stretched, which decreases the lumen size of the arteriole. Does everybody follow me so far? Which decreases blood flow to those areas. And that's, I think, why people have demyelinating diseases from the nervous system and spinal cord being stretched from bad posture, that forward flex posture that we see so common. Investigational stroke. There's somebody that should be here tonight. She actually had a stroke over the weekend, and she was in the tank today. And the sooner you get in, the better. But they even have studies that they start at 6 months, and they do dramatic results with people. Like he talked about, all the Israelis are doing all these great studies over there. Reflex sympathetic dystrophy, bowel disease, chronic fatigue, of course. You're not making enough oxygen. You're not getting enough oxygen. You're not making enough ATP. Dementia, traumatic brain injury, SIBO, infertility. And I didn't know about these two either, opioid withdrawal. So I don't even know how it works, but it must be doing something. Protocol. Optimize all stages of it, so you're going to stimulate all these cells, like, you know. And I was watching this thing, and I've always talked to you guys about regenerating disc and trying to get your spine healthier again. So if you can stimulate like chondrocytes, which help build cartilage, fibrocytes, osteoblasts are building what? Bone, osteoclast proliferation. This actually helps break down the bone, but you want your bone to be healthy, so you need both those sides working. I know I'm talking fast, okay? Antioxidants, increases your antioxidant stem cells we talked about, decreases inflammation, but also inhibits cell death. And a big one is it helps your body build new cells. Like if you had a heart attack, you want to make sure that your body's building new blood vessels. That's what angiogenesis is. Everybody following me so far? Start looks out there. Okay, good. Protocol. What we do is 1.3 here. There's no problems with that. From some conditions, whether it's like if you had the bends, has everybody heard of the bends before?
Oh, yeah.
Like that's from scuba diving and going up too fast. You're probably going to need a little higher. You probably wouldn't come here to do that. But every other condition we talk about can be done in a soft chamber, and I will have Bill address that if Bill is watching right now. Here's what I kind of learned too. It's like oxygen is attached to red blood cells. We know that, right? But it's also the oxygen's dissolved into the plasma, okay? So I thought maybe the hyperbaric increase the saturation of the red blood cells. But no. The red blood cells, like when they check your oxygen saturation, as you have done when you do your finger and you see it at 98%, those red blood cells are already loaded with oxygen. So where we get most of the benefit is through this thing called, well, I'm jumping the gun here, a safe, effective method of delivering more oxygen to the body at the cellular level, non-invasive, non-pharmaceutical, at 1.3 atmospheres, no side effects, enhances oxygen-dependent vital cell processes, facilitates healing. But Henry's law, oxygen is a gas at room temperature, right? Everybody's breathing. Yeah, you're not breathing in a liquid. Okay, but when the human body is composed, your body is like 73% water. Your brain, like I said, is 83% water. Henry's law states any gas under pressure is more likely to be dissolved into a liquid. So oxygen, a gas under pressure, dissolves better into blood, a liquid. Okay, so what we see is when we increase the pressure, so what they did is they took this pig, and they took all the red blood cells out of the pig, and all they had was the plasma, okay? And what they did is they did 3 atmospheres of pressure, and what they did is they oxygenated the plasma so much that the pig lived without any red blood cells. And then what they did is then they put the red blood cells back in, and the pig was fine. So what I'm trying to teach you is that what happens is that the hyperbaric doesn't affect the red blood cells. It's really saturating the plasma, the liquid in the blood. Everybody cool with that? Okay, good. And we talked about sea levels, 21% oxygen. Your hemoglobin is already at 97, 98% at sea level. The other thing is we used to have a guy here that used to do live cell analysis. And what I would consistently see with people, and we would see on the microscope, is that we would see a lot of people's blood would be all clumped up, and the red blood cells would be all clumped up. And one of the benefits of hyperbaric is it unclumps that blood. Unclumped is a word, I guess. Unclumped red blood cells after mild high. So what it does is it separates the cells, so the red blood cells that you do have are going to be more efficient because they're not being clumped together. Does everybody understand? Okay, good. I know I'm going fast. Who, when, and why, and how much? Well, this is kind of cool. And neurological, just about every child and adult we see benefits from HBD, lasting neurological benefits after 10 1-hour-long sessions. Many research studies have some huge benefits when using 40-plus sessions. Like if you had like full-blown pre-Alzheimer's, it would be worth it to put 40 sessions in there to grow your brain back. Would you not agree? Mm-hmm. Unless you want to, yeah. Okay, good. Skip that. You want to pull on Bill or?
That's
okay.
what I was waiting for.
Okay, just give me a couple more minutes, Bill. So the immediate effect, which is kind of like kind of an oxymoron or kind of a counterintuitive to what you would think, is that the immediate effect is going to be vasoconstriction from the pressure, right? So that's going to be good if somebody just had a fresh stroke, because it's going to limit any amount of loss more blood. We talked about the inflammation, the pain. We talked about the stem cells. It comes from bone marrow and the central nervous system. It increases neutrophils, macrophages, which are your white blood cells, which is your immune function. Kills anaerobic and facultative anaerobic and fungi. So even a lot of theories are that a lot of cancers are just fungi. So if we're going to kill all that crap, it's a good thing, and it potentiates antibiotics. Hopefully none of us in here has to take antibiotics. I've never taken an antibiotic, and I never want to take an antibiotic because I like my microbiome the way it is. All right, so this is a graph with increased pressure, how it kills Staph aureus. Cancer. In fact, we have your testimonial in here. Cancer and HBOT. Like I mentioned already, when my grandmother, when she was like 87, they told her she had throat cancer. I go, so she smokes and she drinks. Give her a break. She's 87. Then they started doing friggin' radiation on her throat. And that was worse than the cancer that she didn't even know she had. Okay, but she got all this burns and everything. If she would have gotten the hyperbaric, it would have helped with that a lot. Theoretically, will help increase the effectiveness of chemo and radiation. I would prefer you do some HBOT, ketogenic diet. All the things that we're going to get over here are going to be great for not treating cancer, but upregulating your body so it can heal itself. If you had some type of surgical intervention from cancer, and what my goal is to prevent cancer. Okay? There's my friend Al, another good-looking bald man. Okay, see, he's got his beanie on. So bald people have to wear beanies. So Al's a good friend of mine. We're surf buddies. We have the same haircut.
Yep.
His is different, mine a little bit. So Al had some amazing results. You were diagnosed with prostate cancer
Prostate and bone cancer.
and bone cancer.
At the
The
fourth.
prostate metastasized to the bone, right?
Yes.
Okay. And you had a super high PSA. And he's done conventional medicine, but he's also done hyperbaric, beamer, and he's done chiropractic, obviously. And you had amazing results.
Yeah, my doctors are blown away. They can't believe my numbers coming down so quick on my PSA level. I started out pretty much a record high over at ECI and St. Joseph's Hospital of 6,639.
And some people don't believe me when I say that. I guess they have to see your
it's,
results.
doctors don't even believe it.
And then it's down to what now?
As of last month, it's down to 2.2.
Oh my
And I go in
God.
tomorrow to get blood work done, and I'm hoping for 0. More than likely it'll be 1. It seems to cut itself in half every month. But I can tell by going in the hyperbaric chamber that
With the oxygen concentrator.
it's really killing my cancer off really fast. So, really,
So the hyperbaric's great for cancer, it's great for Alzheimer's, it's really great for just upregulating the entire freaking, it's a biohack for your entire body, to just upregulate your overall function, energy, longevity. So, I mean, I get in here periodically, I need to get in more to just really enrich my brain and keep it super healthy and prevent things like Alzheimer's from happening.
yeah.
Anything else you want to say in closing?
I'd say this chamber is a lifesaver. It's pretty much saved my life, along with the help of Dr. Bill.
Alright.
He's been my mentor throughout this whole adventure I've been on, and he's helped me out tremendously. I wouldn't be here without him.
And use a little CBD too. So.
Yeah.
All right, give me a hug, buddy. Look, all right, man. What
All
do you
right.
do?
All right.
Thank you so much. Peace out. So Al's a good friend.
Oh, don't do that again. All right. What's this one show? You want me to bring on? I think this basically shows pressure. Oxygen under pressure forces more oxygen into the tissues, encourages new blood vessels to grow. That's the angiogenesis I talked about. But it pushes it out into the cells so that your body gets more oxygen to those cells. Okay, that's what that says. Otto Warburg basically said there are many causes of cancer, but there is only one prime cause of lack of oxygen at the cellular level. Okay, everybody's heard of Otto Warburg before. He was big on the whole thing with mitochondria and everything. Non-toxic metabolic management of metastatic cancer in mice, novel combination of ketogenic ketone supplementation, hyperbaric. So yeah, we could change the diet, but there's so much more. You could do cryo, you could do cold water immersion, you could do meditation, you could improve your sleep, you could get adjusted. All that's going to contribute to something, to me, that would be better than going the conventional route, which is burn you and toxic, make you toxic. So yeah, it's all the same thing. Hyperbaric oxygen therapy is an event I speak at quite regularly. Is the truth about cancer, slows cancer growth, boosts supply of circulating stem cells, promotes growth of new capillaries and blood vessels, boosts efficacy of chemotherapy drugs, increase survival rates in patients with metastatic cancer by 77% when combined with the key. That's pretty high level, don't you guys think? Okay. Promotes new nerve growth in the brain. That's pretty good too. Reduces radiation-induced inflammation in tissues and stimulates oxygenation, vascular healing. Okay, we're going to do these. These are from our sponsors, which happens to be my own sponsor. Okay. So, I mean, I don't know how much I have to drill in you guys about the water. Everybody's pretty good on that one, right? You got to work that, and if you can't, like I said, you can't do the whole house. Just at least do the shower filter, okay? And then the drinking water is going to be a whole other issue. In reality, in my opinion, you need both because you want to make sure you get everything out of your drinking water. And, you know, whether, like your clothes, you're wearing toxic clothes, you're sleeping in toxic bedding, you're eating on toxic dishes if your house does not have whole house filtration. And then also, we now can take credit cards for our CBD products. We got out of jail, okay? I've been in jail for a lot of things. Being very vocal and outspoken has really kind of affected me in so many ways, you know what I'm saying? And then everybody's been asking about who was asking about the CBD works? There's been a couple of you asking about it. No, she's not here tonight. Michelle said she was coming tonight. But the thing is, like, I was into 420 back before 420 was cool. I was back in the 70s again, okay? fact, when I was 21, I had a whole grow room in my 2-bedroom condo. And a mushroom grow room, too. I was a biochemistry major with an emphasis in horticulture.
We should have done it on Thursday.
But we're going to do 420. It's going to be on 418.
We're on 418. You should
But
have
that's
done
Thursday?
Thursday, yeah.
Yeah, I don't have to watch those on Thursdays. I'm here by myself. It'd be hard to do the dance. Okay. All right. Let's bring on my friend. Is he here somehow? How do I come back to this if I want to?
We just have to come back to it.
Okay. Let's give it up for Tori. He's the man behind the scenes. He never gets enough love. He's the one that gets you all those emails and the text messages. He's the sweetest guy you'll ever meet. One of the happiest guys you'll ever meet, too. Right, Tori? Sure.
Recording in progress. Recording stopped.
He knows what he's doing with all this stuff, too. That's like...
Yeah.
Hi, Bill!
Hey, what's up, everybody in Southern Cal?
Hey, what time is it back there?
Billy?
Good, good. So Bill's the guy that got me into hyperbaric a long time. He's one of the foremost experts in hyperbaric. I kind of just got into the basics of it. I don't know what you want to touch on. Then I got a whole kind of like, I'm going to wrap it up at the end. But what do you want to talk to them about? And then if we could open it up for some questions, because I mean, this is like one of the foremost experts on hyperbaric in the world. And thank you for showing. He's out in North Carolina?
We're out in Georgia.
Georgia, okay. So it's 9 o'clock there, 9:15.
It is. And I'm trying to get the volume up here a little bit. Can you guys hear me?
We can hear you loud and clear, Dave.
Yeah.
Okay.
In fact, you're loud. You're loud.
Yeah.
Yeah, well, that's good, because I'm usually loud even without microphones and stuff. I'm kind of like you, Billy.
Yeah, I know.
So,
But you got hair.
but listen, can we give Billy a big hand?
Oh, please. Thank you.
Let me tell you why. That was some of the best. I only caught the last 20 minutes of it, but that was some of the best explanation of I've heard in a long time, and I've been doing this for 23 years on hyperbarics.
I studied a lot,
You really did a great job, Mr. Billy.
and I'm not even done.
I can see
I
that.
kind of was like looking like there was like deer in the headlights. I don't know if it was like, I don't know if I was boring you guys or what, but okay.
No, that was an awesome job.
So he's also he's a sponsor at the Cal Jam that we do every year, and every year at Cal Jam at lunch I would go get in the hyperbaric. I would take that. It's called napitation, where it's a kind of meditative nap, and I would just get charged for the second half of the day, and I would do the beamer before that too. I'd do the beamer, and then go get in the hyperbaric, and you'd set me up for an hour in there, and then I go rock the rest of the show. Okay, so what do you want to say to these folks?
I've not much more to say. Jeez, you took 23 years of my life and summarized it and did an awesome job.
Well, I'm not done yet either. So
yeah, I will throw a couple of things out there.
Yeah, do that.
You've got the science pretty much down packed, and I think your people out there do too.
You know what I don't have down? I don't have the
What?
marketing down because the thing's way underutilized, and I know it's a tool that needs to be. People need to understand it so they understand why they're utilizing. I've got friends that are like booked solid, and I have a hard time booking like anybody. So I don't know what we're doing. Do I need to put that thing in the front office so people trip over it on the way in, or what?
You know what? We'll let's you and I get on a phone
Yeah.
sometime soon
Okay.
and do that there. But I've got 5 chambers in my clinic, and they're booked, all of them, every day.
I know. And I was
And
listening to
the
this
biggest
guy.
thing is,
From
the biggest
Israel
thing-
saying they got 200
yeah,
people a day and they've got 20,000 people wait list to get in. I'm going, Jesus, send me some. But that's from Israel.
but most of it's I don't advertise anything. So the biggest thing is that people see results.
Yeah.
When they go inside the chamber and they see their loved one walk. I had a new patient today go in the chamber that had a stroke, and he really couldn't talk. When he went in the chamber and came out, his mobility was like completely different than when he went in the chamber.
Right.
So, a couple I'd just like to share with you. Number one, let me ask you all, what kind of drug do we give a burn victim?
Nothing.
No. Okay? We don't give them anything. What kind of drug, but we do put them in hyperbaric chamber. What kind of drug do you give somebody with the bends?
Hyperbaric.
Nothing. We put them in a hyperbaric chamber. What kind of drug do we give somebody with carbon monoxide poisoning, a flesh-eating bacterial wound, etc.? So the real point of the matter that I'm trying to get across is the most difficult, life-threatening conditions in the world. Can you guys hear me?
Yeah,
Yeah.
I just pushed the wrong button,
And now I'm trying to figure this out.
so don't lose us.
It's a,
But keep talking, I can hear you.
okay. All right, so the most life-threatening tools that we use, we don't have, there's no drugs involved.
Right.
We put them in a hyperbaric chamber. Why? Because the ultimate drug or the ultimate supplement or the ultimate healing is oxygen. We go without food for a period of time. We go without water for a period of time. I can't go without oxygen for any time at all. And that's kind of an important thing to try to understand. So the real problem with hyperbaric medicine has been this. The hyperbaric medicine's been around since about 4500 BC, before Christ. And I got a textbook that kind of takes us through this journey of how long it's been around to the 16th century and Cunningham in the 1920s and this and that and this. But it wasn't until about the 1930s we were using hyperbarics more so in a medical approach. But there's the problem. The AMA, which you guys are all probably familiar with, the American Medical Association, decided to play God.
The American Murder
And they
Association.
decided to say who could have access to something and who couldn't. In our hospitals, we have hyperbaric chambers all over the country, but they're at the bottom of the hospital empty. Why? Because they only treat 13 conditions: burn victims, carbon poisoning, flesh-eating bacteria wounds, etc. So if dad had a stroke, or mom's got Parkinson's, or Uncle Joe's got cancer, or we got a child with autism, we got Lyme disease, or a plastic surgery patient, and all these different kinds of patients, they don't say it doesn't work, but they say insurance is going to pay for it. And that's the bottom line. You really want to know what prejudice is in this country? It has nothing to do with the color of your skin. It has nothing to do with who you are. It's all about money. You want to follow the money?
Yep.
You're going to find and follow out what's real and what's not real. That's the bottom line. And when I lecture and speak on hyperbarics across the country, I call people out. Sometimes people don't want to hear it. But if you're a neurologist and you're a neurosurgeon or so, and you're not using hyperbaric medicine, shame on you. The reality is, what is a stroke? I had a 9-year-old little girl in my clinic today with her father. I asked the little girl if she knew what a stroke was. She said no. And I said, well, the stroke is very simple, sweetie. It's a lack of oxygen to the brain. 7 words. Lack of oxygen to the brain. Period. So then I asked her, I said, if you were a doctor, what would you do? And what do you think she said?
Give it oxygen.
Duh, Mr. Bill, I'd get oxygen to his brain. Well, that's exactly what she needed to say. That's complicated. Our bodies are produced with red and white blood cells. If you want to change somebody's biological history, we've got to go back to the very beginning of where it all started at with the red and white blood cells. What can we do? Well, that's what hyperbarics does. So the sad part about hyperbaric medicine is that they only treat those 13 conditions, and that's it. If you don't have, if they turn around, interesting stat, every 37 seconds in America, somebody's having a stroke or a heart attack. Every 37 seconds. If the insurance companies would start treating stroke patients with hyperbaric medicine, it would bankrupt insurance companies overnight. And that's just strokes. We're not even talking about Parkinson's and autism. In autism world, 1 out of 10,000 children in 1980. Today it's 1 out of 35. And by the year 2032, it's going to be 1 out of 2 children. We have a crisis going on.
Yep.
And we need to call people out on it. And the reality is, hyperbaric medicine probably, and Billy, you know, if I say something that's incorrect, please
Yeah,
tell
you're
me.
saying
but I'll share
something
this with you.
incorrect. Quit calling
Okay.
it hyperbaric medicine. I hate that word.
Yeah, well, I don't like it either.
Hyperbaric chiropractic. How's it sound?
But that's a better word for it.
Yeah.
And then what's so wonderful about working with the chiropractors and others is that they look at the body as a whole. The whole body. They're treating the whole body, opening up pathways, etc. We just have a tendency to go straight to the cell itself. There's probably nothing in medicine that's better than hyperbarics due to the fact that hyperbaric affects every cell in the body. And just like Billy said, the red and white blood cells, once the red blood cells have been saturated, the excess oxygen dissolves into the plasma. That's the big point, because I can carry more oxygen than plasma than I can in a red blood cell. It's kind of like having a cup of coffee. I put some sugar in the coffee, the sugar dissolves. I fill the coffee cup up to the top and I keep pouring coffee in it, and it's going to overflow. And if I took the coffee and I dump it on my table in my house, that coffee is going to go everywhere. And that's what happens in the chamber. There is not a crevice or cranny that the blood flow doesn't get a chance to get to, and especially the hard to part areas to get to, which is our feet and our fingertips, because it's furthest from the heart. So inflammation, as Billy had said, was that the common denominator of all diseases and conditions is inflammation. And hyper means more, bar means pressure, decreases inflammation and increases blood flow. So we're able to bring blood flow to all the tissues and the organs and glands and bone density from head to toe. The only thing that may trump hyperbaric medicine is stem cells, and that's not true either, because hyperbaric medicine stimulates stem cells. That's why we use it for the burn victim, etc. If carbon monoxide poisoning is taken care of through hyperbarics, we do with everything else. What about addiction? What about drug
How does it
addicts?
work for addiction? I was curious about that.
Well, the awesome thing is that the more oxygen in the cell, more the body detoxifies.
Okay.
So I'm on the board of directors for Life Legacy's challenges, and we're doing a program for women that are in prison that are coming out, and we're trying to get them clean. It's not about just throwing them in a rehab center and not dealing with what's going on with them biomedically.
Sure.
So oxygen in, toxins out. The more oxygen in, the more toxins out. This is one of the reasons that we're able to decrease medications, if not eliminate them. Right. Supplements become much more powerful. IVs become more effective. So now I can do some repair on the liver that's been damaged, or neurologically and what have you, because we're able to cross that blood-brain barrier and deliver oxygen and blood flow to parts of the brain we couldn't get there before. And all of a sudden, I've got neurons that are functioning, because before they only working at 20%, which is part of the reason why when Dr. Carson and Dr. Buckley and myself did one of the first clinical studies on autism and hyperbaric medicine, we could prove that we could cross the blood-brain barrier and ignite neurons that weren't firing. So this is critical. I mean, when we really look at all the different types of things that we work with, they're, from sports to plastic surgery to Lyme disease, et cetera, it's no wonder why we can live without food and water for a time. We can't live without oxygen for any time at all. And just to circle back on what he said about the 35% portion, prior to during biblical times, the oxygen concentration level was at 35%. Before the floods of Noah, there was a canopy of pressure that surrounded the earth. That's what a hyperbaric chamber is. It's a canopy of pressure with a higher level of oxygen. No wonder why the dinosaurs were so huge. The reptiles and stuff there, they show that the fossils, that the rib cages were very small compared to the size of the animal, and that means the lungs were smaller because they didn't need to breathe as much in. So it's truly an amazing tool. If I was to go to Home Depot right now and I was trying to find a stove and a lawnmower and all kinds of things that could do, one tool could do so many different things. That's what hyperbarics is in our world.
Okay, let me ask you a quick question too. Prior to me buying the oxygen concentrator, the ambient oxygen in there would have been 21%, correct?
Correct.
So with the oxygen concentrator, you said that brings up that concentration of oxygen to 95% or 94%?
Well, what really happens, Billy, is that the air that you're breathing now, the ambient air, that's taken from the room that you're in. It goes in the compressor that cleans the air out to 0.01 micron. So the air is about, going in there is about as clean as it would be if I was doing surgery in a surgical room.
Okay.
But we use the oxygen concentrator because we're trying to maximize the potential of the chamber. Okay. So the concentrator takes the air in the room and separates oxygen from nitrogen and other gases between 91 and 95%.
Okay.
So when we wear that mask, now that's going directly into the orifices of the mouth and the nose, and we're utilizing that. And when you're working with traumatic brain injuries, and a lot of the things that I work with on a daily basis, I don't want to leave any, stone unturned or leaf unturned. Right. I want to maximize the potential.
So you're actually maximizing it by a factor of 4, if I'm thinking correctly. It's a 24%, and the pressure's the same. You're getting a 4 times level of amount of oxygen saturation. Would that be? Oh, come on. I thought we extended it. All right. I think we lost him. So he was good though, huh?
Yeah, it was awesome.
Cool. He's fired up like me.
Yeah.
All right, let me finish up with what I got. I'm not sure if we can get him back. I don't know if I could at least say goodbye to him. That wasn't half an hour. We started at after 6.
He said he was on there for 20 minutes, so listen.
Yeah.
How come we lost him?
Yeah, because you had 40 minutes.
Oh.
Yeah, and he was already on before you.
Oh, I thought you said 6.
Yeah, no, he was on before, and when that happens, the timer just starts.
Oh, okay. Well, I told him to go. So you guys got enough for him. Let's just finish
Oh,
up.
yeah.
And it can be done. Okay, cool. Can you just tell him thank you? Because I don't know how to do it. Yeah.
Let's just put it back. So.
Okay, where was I now? I think I was right. HBOT anti-inflammatory. There we go. Okay, a lot of athletes use it too. You guys know that, right? Like LeBron James sleeps in one. I've got a good friend of mine that's a chiropractor that I turned him on Hyperbaric. He actually sleeps in his every night. He takes a bottle in there and then pees in it and it stays in there all night. In fact, you guys know him. He used to be your chiropractor in Washington. And he's actually reverse aged himself. So that's really kind of the focus. I mean, he looks younger than he used to. He's also doing the Beamer and he gets adjusted all the time. We already talked about burn patients. We already talked about post-surgical, but I think where a lot of athletes use it is like getting back on the field sooner. Let's talk about, this is a facial surgery, so like all these surgical plastic surgery units that we've got on around here, I call them boob shops. A lot of the facial stuff can be benefit from the anti-inflammatory effects of and also the wound healing capacity. Hyperbaric can improve post-concussion syndrome years after a mild traumatic brain injury. But the gig would be to get in there as soon as possible. Then you're going to get maximum benefit from it. Sports, decrease swelling pain, hypoxic traumatized tissue, speeds up healing tissues, ligaments, fractured bones, because it stimulates those osteoblasts, osteoclasts, stimulates the chondrocytes in the cells, the fibroblasts, which makes all the fibrous tissue, reduces scar formation and damage, helps return players sooner to the game. Hypoxia is the major component in the changes that affect injured tissues. Okay, I don't know. Does anybody know who Heinz Ward is?
Yep.
You do? Who is he?
Football player.
Okay. Knee injury. AFC championship to be at the top of his game for Super Bowl. How about this? Any of these guys? I don't follow sports anymore. Anybody know who Terrell Owens is?
Yeah.
Oh yeah.
Okay, he owns a chamber. I said LeBron owns one. I don't know any. I used to follow sports in the '60s. I had baseball cards, and I watched the first Super Bowl, but I couldn't even name a professional football player right now, or basketball player, or a baseball player, or a hockey player. All right, how about this guy? Does anybody know who Trey Hardy is? No. And that looks like an old person. That looks like Blanda or somebody. Who is that guy in there? Hyperbaric oxytherapy, treating sports related. All right. So the other thing that's really interesting is how we can use it to improve cognitive function. And what this is a guy that I listened to. His name's Jeff Sheff or something. But he talks about a lot of these guys up in Silicon Valley want to get an edge on the whole, technological game. So they do these hyperbaric treatments to just increase their cognitive and creative factors. Cognitive enhancement of healthy young adults with hyperbaric oxygen. Also, they tested it on students to check their grades, which were all improved after just 5 treatments. What's that one say? Same thing. It helps heal wounds. Effectiveness of hyperbaric oxygen treatment of complex regional pain, like things like I talked about, the RSD, reflex sympathetic dystrophy, which a lot of people are just on opioids for that stuff. So if there's an alternative to opioids, as simple as hyperbaric, that would be great. Things like reflux, I didn't know that until I was doing this research. Colitis are improved with hyperbaric. Hyperbaric oxygen therapy stimulates colonic stem cells, so that's how it helps with this, and induces mucosal healing in patients with refractory ulcerative colitis and perfective case series. I'm going through these really fast. chronic fatigue. I mean, that's simple to understand. We got more oxygen, we got more ATP, we got more energy, right? And there's nothing that the medical profession can do for any of this stuff. You know what I'm saying? You could do this, you could do red light, you could do the cold water immersion, you could do meditative stuff, you could do the Wim Hof breathing stuff. All that stuff's going to improve this stuff, but none of that stuff's even recognized by, I mean, what are they going to give you? If you go to a medical doctor, they're going to tell you to do any of that stuff. And then chiropractic, right? Which removes that nerve stress, which allows you to function at a higher level. Come on, man. All right, these are spec scans. So the blue is bad. The red and the yellow is good. And this is pre-hyperbaric. You can see big lesions in the brain. And then you see right here, we've pretty much erased that whole blue area. I mean, these are good objective data that shows how it works. I mean, look at this one compared to, and that was just 10 hyperbaric treatments at 1.3 atmospheres. So that's why I'm saying I got to get in there more often. In fact, I was listening to this podcast on the way home from Mammoth the other night. It was a 2-hour podcast, and Jane was driving, of course. And she looked over at me and goes, yeah, I need to start getting back. Because you're listening to this stuff, and you're listening to all the benefits, and you're going, I need to get back in that chamber. Because when she fell, she passed out one day, and she fell down and hit her head and chipped her teeth. I mean, I think she just was hypoglycemic. And then I ran her over to Back Bay Imaging to make sure she didn't have a bleed, you know, to make sure that she was fine. And then we just started putting her on hyperbaric and healed up. And even her skin lesions. And then she was also using those patches too, the stem cell patches. Which is another thing that we could get into too. I mean, there's so much stuff you can do. So we got to get those guys here to do the stem cell workshop, including Suzanne. Before, fall, after 3 stroke treatments, I mean, you can see a major difference in the healing of her face. Okay, hyperbaric induces late neuroplasticity, which means the growth of new nerve cells in post-stroke patients. There's another spec study of somebody with a stroke, and you can see again, the green is bad. That's before. That's after. You can see the other areas of the brain that were all. And you're not going to be able to rejuvenate dead cells, but the cells, the senescent cells, or the cells that are downregulated in the surrounding areas because of a deficiency, not a lack of, can be rejuvenated through that process. Okay? You can't, like, once the cells are dead, they're dead. Yes?
I was going to say the light hyperbaric, which is what this particular equipment does.
It's mild.
The mild, I consider incredible. When I worked for Dr. Whitaker,
Julie, down the street. Okay,
I
cool.
had so many hyperbaric oxygen treatments, but in the chamber at those higher levels, the pain in the ears, the discomfort.
Right.
And that's not a
And
pleasant
it's,
thing.
you're not
And
getting any
this-
benefit from
yeah,
it either. So
this is a joy to do.
yeah.
You know, being able to get in there and receive the benefit without the downsides, not needing huge tanks,
Right.
not needing,
Huge amounts of pressure.
people,
Right.
you know, to watch.
And you can get
your-
in there
your every
with
move.
whatever too. You can get
Yeah.
in there with your phone, and it's not that we allow
Yeah,
phones
it's
anymore.
mild
Yes.
is wonderful.
Oh,
Okay,
Dr. Billy.
yeah.
I will translate.
Słuchaj,
I will translate.
wczoraj zaczęła się moja przygoda
Yesterday I started my
z komorą
journey with
hiperbaryczną.
Hyperbaric Chamber.
Pan doktor
Dr.
zaproponował.
Bill,
Jestem po wypadku
I was after an accident,
i tutaj miałam bardzo silne
and as a result, I still have colored under eyes,
które od 2 miesięcy praktycznie się nie zmieniały.
and it just didn't change in the last 2 months.
Po wczorajszej sesji 60-minutowej,
After the first 60-minute session,
jak się czułam?
how did I feel?
Czułam się niesamowicie.
I felt incredible.
Chociaż bardzo bałam się tam wejść,
I was afraid to get in,
ale tam jest relaks.
but I was so relaxed.
Nie odczuwa się niczego.
I didn't feel anything uncomfortable.
Jest tak wygodnie, że lepiej niż na swoim łóżku.
I feel so comfortable, better than my own bed.
Jak wyszłam z komory,
When I left the chamber,
chodzimy z mężem codziennie na bardzo długie spacery.
every day we go
Kilka mil.
for for very long walks, like 3-4 mile walks.
Zawsze mi brakowało powietrza.
Every time we go for that walk, I
Wychodziłam jak
have to stop, a couple of times because I'm out of breath.
Po wczorajszych 60 minutach
After yesterday's 60 minutes,
moje stopy szły przede mną.
my feet were ahead of myself.
Miałam tyle
I
energii.
had so much energy.
Dzisiaj po raz pierwszy tak naprawdę spojrzałam w lusterko.
For the first time today, I really looked in the mirror
I
because I hate to look
zobaczyłam,
at myself.
zobaczyłam, że tego jest dużo
And I
mniej.
saw that the discoloration has dramatically been reduced just
A
after
miałam
one
tyle
session.
siły, że wysprzątałam mieszkanie jak na Boże Narodzenie.
And I had so much energy today that I spent the whole day cleaning the house.
Good.
A,
Should get frisky too.
i, ta przygoda z komorą
Jest-
hiperbaryczną się nie skończy. Ona się dopiero zaczyna.
I know that this is just the beginning for me, the
I,
journey with the hyperbaric chamber.
I życzę Państwu, żebyście chociaż
And I
raz
wish to all of you
spróbowali
just to try it once.
doznać czegoś, co jest tak
Try.
zauważalne od razu.
To try it out, something that you can feel after the first session.
Dzisiaj też się zakończyła moja
By the way,
dwumiesięczna.
we're not selling this, okay? We're not
I,
selling
I had no idea. I've been putting them in there. Yeah, she had these circles under her eyes, and I was doing all this research, and I said, let's just put her in there and see what happens, okay? And I didn't know she was even going to talk tonight.
Dzisiaj
So.
też się kończy moja dwumiesięczna sesja.
And I guess today my 2 months sessions with
Na
Dr.
kręgosłup.
Bill are
We're going to
ending.
work something out. Don't
Yeah.
worry.
Okay.
I want to help her.
I chcę
Your
podziękować.
eyes do look better
Nie,
too.
chcę
Thank you.
podziękować
I want to thank you
dr Billy
All right.
za Twoją radość życia,
What's that?
for your happiness, your lively happiness,
Yeah, of
Mądrość.
course.
for your wisdom,
poczucie humoru
for your humor
i
Oh, my
niesamowite ręce, niesamowite dłonie.
and incredible hands.
Thank you. Thank you, doktor.
Don't you love these Europeans? Yeah, I didn't know. Had any idea you were going to do that, but thank you.
Roper, no.
I figured, what have we got to lose, right? I said, get in there, it's on me, all right? So, let's see, that's the big one for me is these kids, man. It's just like you said, 1 and 2, it's just like it's all, and I know what it's from, and you guys all know what it's from if you listen to me longer. It's from all the neurotoxic chemicals in your vaccines, and I mean, the blood-brain barrier is not even developed yet. These kids are being literally destroyed. And reading those books like The Great Reset, I mean, they want to get to a point where your kid, did I already say they want them to be cyborgs? Did I talk about you about that?
Yeah.
Sexless cyborgs without any capacity to breathe. They'll pick whatever career they want them to have. And this is where we're headed. But the thing is that if we can make people what? More stupid, and that's what they're doing, making people, does anybody notice that, or am I the only one that notices the fact that people are very dumbed down? There's a lot of factors to that. It's also the education they're getting, because we're more concerned about like gender issues than actually learning things like math and science and English and how to talk. Like there was a patient I had yesterday, he was just so polite. He was 73 years old. He was just very polite, said thank you, and you know, it was just like, it was such a breath for me to see somebody that had like manners again, you know, because kids don't have the manners anymore. Like, I don't want to say anything, but I'm going to say it's, kids don't say thank you anymore. And when I was a kid, I remember I showed a utmost respect for adults, you know, and the kids don't call you Mr. or Doctor anymore. They just, it's just, to me, it's different. And like I used to get in trouble when I was a kid from one lady. She goes, "Don't call me Mrs. Giuliano anymore. Call me Beth." And I was just such in a habit. When it was an elder, I had respect for them, and that's the way I treated them. And I think that's something that we've lost today, where kids don't respect their elders anymore. But that's just my opinion on that. Okay, we're gonna watch another testimony, because testimonies are really good.
All right, Dr. Bill here with Susie, and she just told me some amazing results she's getting with her autistic son with the hyperbaric. Why don't you just kind of reiterate what you said? You said he did really better in school the first time he used it?
Yes, after the first visit, teachers came back and wrote on his paperwork saying that great day, and he actually went up to peers and actually started interacting with them.
Right, and what else have you noticed with him?
He's been using more words. Instead of using 3-word sentences, he's actually using, "Oh, perhaps we should go here," or "by the way," you know, words that he wouldn't use before.
Right, and you've only been in there is third time?
Third time
So
only.
you've seen amazing results at 3 times.
Yes.
So great, I just wanted to let people know that if you had children that are suffering from autism, we have a great tool here at the office which helps oxygenate the brain. It's called Hyperbaric. You just need to be in there for 50 minutes, and there's other tools that we have as well as far as open up circulation of the brain. But give us a call at 949-250-0600, DeMoss Chiropractic. Thank you, Susie, for sharing that.
Thank you.
I mean, I just met her. She's actually referred by another chiropractor to come here because we have the hyperbaric, and her kid's autistic, and she can't believe the difference now. It's amazing. I'm even amazed. Skip that. Here's some more spec scans. You can see the before and after, and this is a patient with this is a kid with autism. You see how there's a lot of blue and greens here. You can see there's more red, and that's after looks like 3 months there. No, it's 2.5. No, it's 3 months. Okay, so that's going to be probably a significant amount of dives in the tank. HBOT, anti-roll Asperger's. Before he had behavior issues at school. Was easily frustrated, changed for the better with hyperbarics, allowed him to make friends and interact more appropriately. Socially, extremely overactive with poor focus, hyperbaric treatment improved his attention tremendously. Sleep, abnormal from 16 months of age, normalized with 3 hours of hyperbaric. Cerebral palsy, another thing that's been, I mean, you got to give these kids a little, and I think these kids should also be getting, obviously, like kids with cerebral palsy should be getting adjusted as well. Contraindications would be things like respiratory infections. I don't know why that is. It seems to me that it would be a good way to eradicate that. Seizure disorders, acute asthma, claustrophobia is the main one that we see people get in there. For some reason, I don't know why they can't sit in there. I love it in there. HBOT. The other one is untreated pneumothorax, which obviously we're not going to put anybody with pneumothorax. Okay. The great synergizer, think about HBOT, there's inflammation, hypoxia, a wound. We already talked about that. We've got specials. If anybody wants to try it, it's $100 for the first session. Or you can do 5 sessions for $375. I mean, if you go anywhere else, like all my friends, they do it for like $150. So I want to get it utilized, so I'm selling it super, super cheap. I don't know what 5 times $375, what that comes out to. It's like $75 a visit or something like that. All right. And for those of you already know the chiropractic story, I don't need to go into that. There's one thing I wanted to show. Like I had a guy that was coming here that was pre-Alzheimer's, and I know they weren't doing anything nutritionally, and that's one of the things you got to do with Alzheimer's. You got to cut the sugar out. You got to go super ketogenic. You got to detoxify like you and I are doing. I think we're the only ones from that workshop that are doing the detox program. And you've already noticed benefits from that too. He went off his blood pressure medicine from that. Because again, the more chemicals you're carrying around in your body, the more you're going to have, the body has to deconcentrate that, so it's going to increase your blood volume, which is going to increase your blood pressure. But like I was thinking about that, he was an older guy, he wasn't getting adjusted because, I mean, for some reason they're afraid of chiropractic. But C1, upper cervical, not only increases blood supply to the brain and the head and the pituitary gland, but also those joints up there, there's these things called mechanoreceptors, and when you move those joints, it feeds the brain that healthy information. The other thing, as your posture goes south, so does that proprioceptive nutrition that goes to your brain, it also goes south. So everything that we're doing, not only increasing range of motion, upper cervical, changing posture, all that, it's improving brain function. And one of the most important things that you do for brain function is movement, right? So sitting is the new smoking, because when you sit, you're not moving. Like when I went to the beach today, I didn't want to work out today, but I did it because I need to do that so I could be on for you guys tonight, okay? C1 also is headaches, nervousness, head colds, high blood pressure, and imagination is more important than knowledge. Albert Einstein. Curiosity is more important than imagination, but without oxygen, neither is possible.